So this is my heart dissection, and we'll start by discussing the flow of the blood through the heart and discuss the blood vessels supplying and leaving the heart, as well as ending with the various structures of the heart. To begin, there are 4 chambers within the heart. Deoxygenated blood begins in the right atrium. This is fed by the superior vena cava, as well as the inferior vena cava, which are 2 large veins that carry the deoxygenated blood from the body to the right atrium. From here, blood is pumped into the right ventricle. And separating these 2 chambers, the right atria and ventricle, is the tricuspid valve. It's kind of hard to appreciate in this dissection, but the tricuspid means 3 leaflets, and those open and close, allowing blood to enter and exit at the right ventricle with appropriate timing through the cardiac cycle. Blood then leaves the right ventricle and enters the pulmonary artery, and that crosses through the pulmonary valve, and that's also a little difficult to see here, but it would look something like this in this respective location. This pulmonary valve is also a semilunar valve that shapes prevent the backflow of blood into the right ventricle. Blood then travels to the lungs in order to become oxygenated, and from the lungs enters the left atria through the pulmonary veins. Blood then flows into the left ventricle from the left atria. The left atria and left ventricle are separated by the mitral valve, also known as the bicuspid valve. And that means there are only 2 leaflets making up this valve. From the left ventricle, blood finally exits via the aorta, and that goes to supply the rest of the body. The aortic valve separates the left ventricle and the aorta. This valve is also a tricuspid valve. Although the heart is constantly full of blood, it still requires its own supply in order to function properly. The coronary arteries are responsible for this. Theoretically, we would be able to see them in the locations. The left and right main coronary artery would be here, and the outline where they would travel kind of follows along this line here. These further divide into smaller branches supplying the entire surface of the heart. The main vein of the heart draining the surface of it is the coronary sinus, and that lies within the coronary sulcus seen right there. This drains directly into the right atrium. So we've already briefly discussed about the aorta, but it leaves the left ventricle carrying oxygenated blood to the rest of the body. The aorta divides into the left and right branches. And since the majority of the heart is located on the left side of the body, the right branch actually has to travel further than the left to supply, that assigned structures. The brachiocephalic trunk is the structure that allows blood to travel the extra distance from the left to the right side of the body. So now we can talk a little bit about external and internal structures. As it lies within your chest cavity, the apex is considered the most inferior, anterior, and lateral part of the heart, formed mostly by that left ventricle. The base of the heart is the most posterior of the heart, and it's formed mainly by that left atria. Looking at the structures within the heart, you'll see the interventricular septum, and that separates the right and left ventricles. The tricuspid and mitral valves are powered by these papillary muscles. The chordae tendineae are these fibrous connective tissue bands that connect the valves to the papillary muscles. The trabeculae carneae, which are the muscular columns projecting from the inner surface of the right ventricle and left ventricle, also pull on the chordae tendineae to prevent inversion or prolapse of the mitral and tricuspid valve back into the respective atria.